chronic back pain from sitting all day? Fell and broke a limb? Losing muscle mass? Or you didn't have much to start with? You may benefit from the services of my next multi-talented guest, Dr. Nikki Carrington, an exercise physiologist, physical therapist, and director of Howard University Hospital Physical Medicine and Rehab. We will start off with, first, how do you get to see a physical therapist? We will have insights on how to avoid needing a physical therapist and hear Nikki's story. Stay tuned.
Baransu Balance Podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Hello. Welcome to another episode of Baransu Balance Podcast. Today we have Dr. Nikki Carrington. I'm so excited to see her. It's taken me a couple of years to get her. And I'd like to introduce you briefly. She is the Director of Physical Medicine and Rehab at Howard University in Washington, D.C. By training, she's an exercise physiologist and has a doctorate in physical therapy. Okay, welcome.
Thank you.
Okay, so I want to talk about some common problems addressed by physical therapists. And when I think of physical therapy, I think of someone who's in pain and needs to get out of pain. And so back pain is a pretty common problem. And I would imagine that you get quite a few referrals, or your department gets referrals like that, especially in the outpatient. What kind of information do you think would be helpful from the referring physician, and instead of someone just showing up with saying, I have back pain? What other information or tests do you need to assess that person?
So back pain is very common amongst every patients who come to physical therapy. Typically, when you see older patients, we deal with a lot of back pain. One of the biggest things that we want to know, and it will be helpful in a referral, because as you know, let me just go backwards. There are some states that are direct access, which means they don't always have to come with a referral. However,
Okay.
So Maryland and DC, Virginia also are direct access states. But at Howard, we still require referrals, and it's important that we get them because sometimes patients don't always know what we're treating. So it's good to know whether the back pain is acute or chronic, meaning has it just been going on for 2 weeks or 2 months or 2 years, because the treatment approach is different. We also like to know what part of the back we're treating, not just back, but is it lower? What part of the vertebral column? Is it cervical, thoracic, or lumbar pain? Sometimes it's in the sacrum, but it's important for us to know that because the treatment would be different as well. And we like for our patients to come typically if they have not already had some sort of diagnostic imaging as an X-ray or MRI. Some insurances require you to have conservative measures treatments, such as physical therapy, before they do an MRI, just to rule out some other things. But back pain comes with many diagnoses and many different causes. So
if someone comes to you without any X-rays, do you see them and recommend some type of X-ray, or how does that work out?
Seen. Yep. So the therapist can see them. We have 30 days to treat them. If they don't improve, then we have to refer them back to the doctor. However, if they're getting better, we can continue.
Okay. All right. Well, that makes sense. Okay. So sometimes when people have acute pain, they say, okay, let me go to the chiropractor. So what is the difference between a chiropractor and a physical therapist?
So this question is a little tricky. I'm not that versed in what chiropractors do, but I'll tell you what I know.
Okay.
So both chiropractors and physical therapists use their hands to treat pain and other symptoms. Physical therapists typically focus on the body's function, strength, and mobility, and we use a variety of techniques to treat it, such as heat and stretching, exercises, cold therapy. We use different modalities. Uh, Electrical stimulation, ultrasound, and things like that. We also help work with gait training and different conditions that affect people's movement, such as, arthritis, even stroke patients, and people with Parkinson's, different diagnoses altogether, concussions. A chiropractor typically focuses more on the musculoskeletal system and the nervous system that include the spine, their joints, muscles, tendons. And so they use, not always, but mainly, a lot of spinal manipulations to make sure that the body is aligned to help with pain. So I think that our focus is different. And for therapists, it's more based on function, functionality, and mobility for our patients, as opposed to just musculoskeletal.
Okay. So if you have someone who has limited mobility, whether it's from a stroke or Parkinson's or recovering from a neck injury, then the physical therapist is the one to help you get back your mobility.
Yes.
Okay.
Yes.
All right. And so I have a question, Nikki. Yes. The days are getting shorter. And you live in Washington, D.C. I live Louisiana. We don't have too many listeners from Alaska, but I know that sometimes the nights don't end further north you get. So what do you do for yourself when the days are short, as far as, now I'm switching to your exercise physiology hat. How do you get your exercise in, outside, or what do you do? Do you run in place, or?
So when the days get shorter, I tend to bring my exercise indoors. I also tell my clients to try to bring them indoors, unless you're a person who can work out before you go to work, or you can get home at 3 o'clock to go for your walk. So there's several different ways that people, now everything is digital. So they can always pull up a YouTube video of aerobic activity, dance, or some form of yoga. You can go to a mall. The space is always open. Earlier typically is pretty open, and you can walk. You're safer in the mall, and you're indoors. If you have the ability at work to bring some sneakers and put on your tennis shoes at lunchtime, I always try to get people to also not think of exercise as just that small little 30-minute time or hour that you take, because studies show that if you have a job where you're typically sedentary and you're sitting, an hour of exercise is not enough. It's just not enough movement. So we're always trying to give people tasks of taking the steps at work. If you're going to go, you're on the 3rd floor, you're going to the 5th floor. How about go up 1, take the elevator up 1, and walk down 2? Walking, instead of making a phone call, sending an email, maybe walk over that document that you have for people, and trying to get your movement throughout the day. Lunch breaks, getting out, walking. If you have the ability to walk through the streets, I'm in the district, so we have a lot of city streets to walk through, and I'm also on a campus. So if I can get outside, walking is great.
Okay, so So if you have a desk job that requires you to sit and answer phones or look at a computer, then technically that half an hour exercise a day is not enough.
No.
And so you need to be intentional and maybe answer some of those emails or have meetings on the go, literally.
Yes. Yes. And we ask people to do the 20-20 rule. Stand up every 20 minutes. Even if you're at your computer, stand up for 20
Okay.
minutes. Every 20 minutes, you stand for a few minutes. Make sure that you're not sitting all the time. And also making sure if you're looking at a computer, you take every 20 minutes, you look away 20 feet so that you're not just looking that short distance at the computer, but you're giving your eyes a break. You're taking a long distance where you're looking and giving yourself that break from the computer. Because after COVID, when everybody had turned to working at home, we got way more patients coming in with back pain, neck pain, shoulder pain, carpal tunnel. Because the other thing is people sit at, they're working from home, but they don't have a desk set up. They don't have an office. Mm-hmm. So, they're sitting in a regular dining room chair or a couch, or sometimes doing things in bed, which is not ergonomically correct. So
absolutely,
much more pain.
Absolutely. Okay. Nikki, I'm going to take a little break because I want to do a sound. Okay, Nikki, we have a question from the audience. Jerry from Connecticut, he asked, what advice would you give to seniors or older adults that might keep them from needing physical therapy? Should they focus on particular types of exercises that would help develop or maintain maximum flexibility to decrease your business?
Right. Well, I think the biggest advice that I could give is no one plans this is don't fall. Do not fall.
Okay, so that means not taking a walk outside when it's icy?
Yes, exactly.
Okay.
Or climbing ladders and things without help and assistance. But on a more serious note, it's important that as we age and get older, we stay as active and as mobile as possible. In other words, sometimes you find that people prefer to get in wheelchairs, but the less mobile you are, it actually increases your rate of mortality. So the key I would say for seniors is trying to make sure you get your cardiovascular activity in, walking when you can, and guided strength training. And the reason I say guided is because strength training, if you're not doing it correctly and you're not doing it right, you can hurt yourself.
Right.
So we have found.
My last interview was with or second to last, was with a strength trainer.
Yes.
And I personally think that it is important, almost no matter what age you are, to at least get some instruction as you start the weightlifting.
Right, exactly. Because we found that strength training is the fountain of youth. We found it.
What?
Oh, definitely. And so.
And what age would you advise starting? 30s, 40s?
I would say in the 30s, especially for us as women, as we begin to age and our hormones change and we begin to lose more and more muscle mass and collagen. Yeah. It's important that we maintain our strength. And I'm not talking about the tiny little pink weights that they're helpful. But just think about it. As a mother, you had a kid, you're holding, your 3-year-old on your hip, you're carrying the grocery bag on the other side, and then you have your keys and you drop them on the floor, right? And you have to now bend down with the grocery bag and the kid on your hip. That's more than 3 pounds of a pink weight.
That's
you
right.
can do it.
That's right. That's
so
right.
doing it properly, and I'm not saying necessarily maximum, but what you can lift to make sure that you're making sure that your muscles are, you're keeping them in good shape. And that's for senior citizens, male and female, is very important.
A brief break for a word about strength training. Number 1, strength training or building muscles strengthens you and improves your lean appearance. Number 2, strength training can improve your metabolism, blood pressure, and blood sugar control. Number 3, strength training improves balance by strengthening your legs, decreases injuries and falls.
Exercise as far as cardiovascular, keeping your heart going, making sure that your circulation continues to stay good. And the biggest part for seniors is balance training.
Oh, okay.
So that you won't fall, right? So you're teaching, because as we get older, our reaction time, it slows down. So, when you're younger, you slip or you trip or, you turn too quickly. Usually you can balance yourself because you can make the movement that you need in order to stay upright. Well, it's not so easy for us as we get a little older. And so balance training is very important.
Mm-hmm. So what is balance training? Is it like ballet or yoga or balance training, walking a tightrope? What is?
Well, balance training can come in several different forms, but definitely we train for balance in order to stay upright, right? We want to be upright and standing. And so it can be a variety of different types of exercises. Yoga can work your balance, strength training exercises, but there are some exercises where you're walking or standing on uneven surfaces. And what it's doing, it's training your neuromuscular system. So it's like your nervous system and your muscular system working as one unit.
And so it has something to do with the eye coordination as well?
Sometimes. So eye coordination plays into balance because that works through our vestibular system. So our vestibular system is basically in our inner ear, and it does help with equilibrium. It helps with proprioception. In other words, knowing where you are in space. If I have my eyes closed, I know if I reach to the right, I know where my phone is. I know where my glasses case is without looking at it. It also, helps you. So if I turn my head to the left, my eyes are automatically going to go to the right, and vice versa. There's things in my ears that also helps with my equilibrium. But we're not talking so much about the vestibular system, although the vestibular system's vision and musculoskeletal help with balance. And as we age, we lose sensitivity because they're neurosensory receptors that we have in each one of those systems that helps us with our balance.
So I mean, is there a resource that you would recommend or we can add to the end of this podcast for people interested in improving their balance or preventing loss of balance in younger years even?
Well, my recommendation is always to, find a personal trainer or a class that typically works with balance. There are several different classes out there. There's systems right now. I can't remember off the top of my head. There was a class that we talked about. I don't know if you remember a few years ago, and I have to get my hands on that. And that is basically all about balance for the older population. It may be hard to find in people's areas, and that's why it's just easier to go and get a trainer that will help you work with your balance.
Okay. All right. Well, I appreciate that. So, Nikki, can you tell me a little bit about your journey to where you are, Director of Physical Medicine at Howard University, and in our nation's capital.
Yes.
And so there's some people out there that may want to have their kids, or they themselves are looking for an occupation.
Yes. So I started off at Howard in undergrad. I was a physical therapy major, and a lot of the classes were science-based. I wanted to be, at the time, only in sports medicine. So I changed my major to exercise physiology. I worked as an athletic trainer at Howard University with the football team and a few of the other teams. And I graduated with my degree in exercise physiology. I went back to school and got my master's in exercise physiology, and I started working in that field. I didn't get to work with the athletes the way that I thought I would, but I mainly worked with the geriatric population, which I came to love. I worked for a few gyms and a few other individual companies. And then eventually I went out on my own. So I worked for myself for about 15 years as an exercise physiologist. Mainly my population was geriatrics and post-rehab patients. So patients who may have had some sort of chronic injury or pain, and they were discharged from physical therapy. And so I would pick up kind of where they left off. One day going to a client's home who had MS, and she had just turned 50. So she really wanted to make sure that she was slowing the progression of her disease, as well as making some changes in her life. I thought, just seeing her get better, seeing her do well, seeing her being able to do some things that she wasn't able to do before she started working with me, I thought, you know what, I want to be on the other end of this. I want to be somebody who can get my hands on the patient before they get to this point. And I thought, I'm going back to school. So I went back to school at 41 to do my doctorate. It was a full-time program, and that's where it ended. I did my doctorate and I graduated in 2019 with my DPT in physical therapy.
Okay. All right. So, and it was all smooth sailing, no problems at all getting.
Oh no, I had problems. So I in my last year, I had to go to my clinic, so we needed to do a physical, and I, at the time was in my 40s, so I wanted to go and have a mammogram and make sure everything, I was in good shape. I had a history of cancer in my family. I had a mammogram and it seemed pretty clear. However, the doctor thought that my tissue was very dense and she wanted to dig deeper, well, the radiologist specifically. And she sent me for a diagnostic mammogram, as well as ultrasound. And doing the ultrasound, she quickly saw an architectural distortion that she wasn't clear on. She was not able to see it again. So she sent me for an MRI, which did note that I had a tumor, and I had breast cancer in my second to my last semester of school. So wow. I had surgery. I had to have radiation therapy, but I am now going into my 6th year cancer-free.
Praise God.
Yes, praise God, definitely.
Okay.
And doing well.
So you had a few obstacles, but the grace of God and able to overcome and be such a help to so many.
Yes, he is.
Yes, and I appreciate your advice throughout the years.
Oh, thank you.
Okay, so any last words, Nikki, that you want to leave with our audience about exercising, physical therapy?
Yes, I have. So I just want to tell everybody, exercise is not complicated. I know with the age of social media and TV, exercise looks very complicated. I mean, you see videos of people losing 50 pounds, 200 pounds. But know that, you fill a bucket of what with a drop of water at a time. And I tell people all the time, if 30 minutes is too much, break it up. You can do 10 minutes, 10-minute sessions. It still will equal 30 minutes. It gives you the same results in the end, and be consistent.
Be consistent.
It's not what you do one day, it's what you do every day. And what seemed hard in the beginning, as you continue to do a little at a time, gets very easy. And you'll find yourself walking, a quarter of a mile, half a mile, 2 miles, 3 miles. And you'll look back and think, I remember when I couldn't even walk a mile, So you want to make it a habit, because this is a lifelong commitment. It's not just for the right now, it's for the everyday.
Okay. So with the dark days of winter coming, we can still make healthy choices.
Yes, it's very important, because the endorphins will help to keep you happy, because these dark days come with a lot of sadness.
That's right. And we need to keep our brains active by keeping our bodies active.
That's right. Very good.
Okay.
Thank you.
Okay. Okay, one last question, Nikki.
Yes.
Since it took me almost 2 years to get you, there was a reason for that.
Yes.
You're very, very busy. Now tell me, how are you balancing things in your life, since that's the title of our podcast?
Yes.
Balance.
So during COVID, during COVID, I had to cancel my gym membership. My relaxation, the way I center myself, is through exercise. As not a cliche, I really do exercise.
Oh, and I love exercise as well.
And I used to run.
Down there on the priority list sometimes.
That's right. I used to run. I like to run, but I started having a little difficulty on my knee. So I started to bike instead, and I do strength training. So I bought myself a Peloton during COVID so that I could exercise, because it was easier when it's warmer, days are longer, but when the days are shorter, I didn't want to go to the gym, and I didn't have anything in my house. So I got a Peloton, and I love it. I get on my Peloton as soon as I get home, and I, take a class, and I like to challenge myself and see where I am on the leaderboard. And it's almost like it renews me. It gives me energy to do, something else in the evening and not feel stressed out. And there are times, though, that I will get up early. I get up at 5 and I'll ride, and everybody at work hates that because I have so much energy when I come in.
Okay.
But, I take time, I go to church, and I do spend time with friends, go to dinner, and my family.
Okay. Mm-hmm. Well, I'll take that. It sounds like an advertisement, but I appreciate inquiring minds want to know.
Yes.
Okay. Thank you so much. Until we meet again. My 3 takeaways. Strength training. The elixir of youth. 2, remember that 20 rule. If your job is sitting in front of a computer all day, get up every 20 minutes and move your eyes from the screen at least every 20 minutes. Number 3, don't give up on your dream. Dr. Nikki was finishing her doctorate and treatment for cancer at the same time. See attached references and a link to exercises for balance. Remember, this podcast is for educational purposes only and does not substitute for advice from your health care provider. It is also a good idea to get your doctor's okay, especially if you have chronic illnesses and are older, before embarking on a new physical fitness or strength building program. This is Dr. Christine Ince wishing you a balanced mind, body, and soul. Please like, subscribe, and share.